Hello everyone, I'm Dhaval Desai, the founder of Arihant Healthcare Technology, a leading healthcare IT consulting firm. Today I'm recording this video to provide a basics about HIPAA and HITECH compliance and why it is important for the organizations who are handling the healthcare, protected healthcare information. Before get started, I would like to provide a brief overview of my professional background. I'm in the healthcare IT industry for more than 16 years now. I worked as a solution architect, cloud architect, and a software engineer. I worked on various healthcare interoperability standards, HL7 CCD FHIR, delivered many successful projects in the healthcare IT industry. Let's get started with HIPAA. Let's look into the HIPAA history. So HIPAA, the first HIPAA law is approved or passed by the Congress on 1996. So that's why it's called as a HIPAA 1996 Act. So August 1996, HIPAA was signed by the President Bill Clinton. And after that, it went through various changes and improvements. In 2003, the HIPAA privacy rules got added into the HIPAA law. 2005, HIPAA security rules takes effect. 2006, HIPAA breach notification or breach enforcement rules takes effect. The most important one in 2009, the HITECH Act, Health Information Technology for Economics and Clinical Health uh, Act, which expands the HIPAA privacy and security rules. It also imposed some stringent rules which imposes the penalty on the organization who violates the HIPAA law or the individuals who violates the uh, protected health information. Department of Health and Human Services oversees the HIPAA compliance and regulation. HIPAA establishes the rules for how healthcare providers can handle, store, disclose, and secure protected health information. But why the HIPAA first thing came into picture? Why we really need a HIPAA? It gives a patient more power and control over some of their most sensitive data. Patient has to decide what they want to share. And why it matters to us, why it matters to the IT professionals? Let's see. HIPAA is mainly divided into three rules: HIPAA security rule, HIPAA privacy rule, and HIPAA breach notification rule. HIPAA security rules outlines the safeguard required for the electronic protected health information. It establishes a standard for protecting the confidentiality, integrity, and availability of the health information. Privacy rules restrict the use and disclose of protected health information, and the breach notification rule requires to notification to the patient and HHS following the breach of the unsecured PHI. Who needs to comply under HIPAA? Under the HIPAA security rule, the entities or the entity needs to be storing, processing, or transmitting the EPHI needs to comply with the HIPAA. So, who are the covered entities? Health plans provider, healthcare clearing houses, and healthcare providers who are handling the patient's health information or clinical information are covered under are has to comply under the HIPAA. Along with the covered entities, the business associates and the subcontractors who are working with these covered entities directly or indirectly has to comply with the HIPAA. Let's ask some questions. Are you come under HIPAA or not? Are you storing, processing, transmitting, or handling PHI or EPHI, whether it's orally or physically? Have you signed a business associate agreement or BAA with covered entity? Or are you a subcontractor to the company that signed a BAA? If any of these questions says yes, then yes, you are covered. You have to comply under the HIPAA. So, as I mentioned earlier, HIPAA is divided into three rules: security rules, privacy rules, and breach notification rules. So, let's study one by one into more detail. Security rules. So, application for entities storing, transmitting, and processing the EPHI data. The security rules are further divided into administrative safeguard, physical safeguard, and technical safeguard. So what is the HIPAA administrative safeguard? HIPAA administrative safeguard mainly focuses on policies and procedure to manage the selection, development, implementation, and maintenance of the security measures. HIPAA administrative safeguard covers security management process, information access management, assigned security responsibilities, security incident procedure, workforce security, contingency plan, security awareness training and evaluation, and business associate contracts and other agreements. So basically, administrative safeguard focuses on documenting the policies and procedures for all these things. Next one is a HIPAA physical safeguard. As name suggests, physical safeguard is mainly focuses on facility access, workstation access, and device security. Physical safeguards are measures that protect electronic information systems, equipments, and the facility that house them from the natural and environmental hazard and unauthorized intrusion. The last one under the security rule is technical safeguard. Technical safeguard are the technology and the related policies and procedures that protects the electronic health information and control access to it. So under the technical safeguard, it explains about access control, audit controls, person and entity authentication, transmission security, and integrity. Now let's jump into the HIPAA privacy rule. Under the HIPAA privacy rule, it is like the privacy rules explains how entities can use and disclose the PHI. So whether it's a coverage of identifiable health information, the privacy rules covers all individuals' identifiable health information held or transmitted by covered entities or its business associate in any form. Rights of an individual. The privacy law provides individuals the right to approve and amend their protected health information, request confidential communication, and request an accounting of disclosures. And use of disclosure requirement. The privacy rule sets a requirement for when protected health information can be used, disclosed, such as treatment, payment, and healthcare operations. The last but not least, and the most important one, the HIPAA breach notification rule. An impermissible use or disclosure under the privacy rule that compromises the security or privacy of the protected health information. So, HIPAA breach notification rules require covered entities to notify affected individuals and HHS of breaches and unsecured PHI. The methods to be used: individual must be notified by the first class mail or email. HSS must be notified online. What are the timelines for the breach notification? If the breach happens, the covered entity must notify affected individuals within 60 days of the covering a breach, and notify HHS immediately and no later than 16 days after the discovery. Notify the media if more than 500 people gets affected from this breach. The notification content must include specific information like date of the breach, type of the breach, and the steps individual can take to protect themselves. Choosing the HIPAA security framework. So now we looked into the HIPAA uh, rules, the security rule, breach notification rule, and the privacy rule. Let's understand how which are the framework which will help to protect your environment or your solution, and which also help you to provide a attestation. So NIST SP 800 is one of the one. NIST NIST CSF, High Trust CSF, and SOC 2. These are some of the certificate which you can gather from recognized organization and make sure you are following and protecting healthcare information data, or the clinical data or patient data. Building a strong HIPAA control. If you or your organization would like to build a strong HIPAA control within your organization to avoid the breach, you have to make sure you conduct a thorough risk analysis. Encrypt your PHI information while storing in transit or storing in the database. Develop a security policies as mentioned in the as mentioned in the privacy rule. uh, Develop a security policies and procedures. Limit a PHI access, so the access should be as required basis. If the employee or associate required the access, then only he or she should be provided the access for the PHI information. Train employees. This is the most important one. I think all the employees which comes under the HIPAA, they must be trained. They should take the HIPAA policies and procedure trainings and access reviews on the monthly basis, like who are accessing your system, what they are accessing, when they are accessing, and where all these access procedure are getting audited. Let's look into HITECH Act. HITECH Act expands the HIPAA. So required healthcare providers to notify a patient of data breaches. The HITECH Act requires HIPAA and the covered entities to notify a patient within 60 days if their protected health information was breached. HITECH Act also enforced and penalties. HITECH Act gave a Department of Health and Human Services the authority to conduct audits and increase civil monetary penalties for HIPAA violation. Expand privacy and security requirement. The HITECH Act extends HIPAA privacy and security requirement directly to the business associate of the covered entities. Conducting the risk assessments. So conducting the risk assessments on regular basis, it's very important if your organization or your product needs to be HIPAA compliant. Make sure you cover the scope and the system. Determine the scope of the risk assessment by identifying the health IT system, data storage, data flows, workflows, and the other assessment consider. Policies and procedures. Review information security policies, procedures, as well as previous risk assessments. Data collection. How we are collecting the data. Are there third-party systems involved? How I mean, there are data gathering questionnaires and interviews, and system demonstration has to be reviewed and documented correctly. Threat and vulnerability identification. Identify the potential threats and vulnerabilities to EPHI, confidentiality, integrity, and availability. Risk analysis, risk management, and finally, a reporting. Document the findings, analysis, and recommendation produced during the risk assessments. So, what are the best practices for your organization to be HIPAA compliant? The most important, and you can start with training. Conduct a regular HIPAA training for all employees to ensure understanding of policies and procedure. Auditing. Perform regular audits to identify any compliance gaps or risks. An audit is the most important one because if there are a breach in your organization, this auditing will help you to identify the breach and close the gaps. Encryption, access control, policies and procedures, and breach response plan. Have a data breach response plan in place for timely breach detection, investigation, and reporting purpose. Here are the HIPAA penalty limits. It's built based on the culpabilities. Basically, if organization have no knowledge of the breach and it's informing a patient on time, so it will be a minimum penalty and depends on the type of breach, the timeline of the breach. If there are reasonable cause, there are different limits for that. Willful neglect corrected immediately within a timeline, willful neglect not corrected within a timeline, so there are separate penalties for that. This table is last updated on October 6, 2023, so there might be a change, so please refer website HHS website online for the updated updated limits. And yes, if you have any question, feel free to put your questions in the comment. I'll try to answer as soon as I can. If your organization needs any help regarding the HIPAA compliance, or if you're building the healthcare product, or you're not sure whether the infrastructure you're following, the database storage you're doing, or the APIs you're building are the compliant with HIPAA, or if the overall procedures and policies you implemented are not, you're not sure about whether it's HIPAA compliant, please feel free to contact us, and our team will happy to help you here. Thank you. Thanks for watching the video.